Have you ever seen one of those advertisements for eye vitamins? Unfortunately, they can generate a lot of confusion and anxiety amongst patients. As an ophthalmologist, it's probably one of the most common questions that I get, and that's what we're going to answer for you today. Do you need to be on an eye vitamin?
The short answer to the question is, well, it depends. If you have a diagnosed vitamin deficiency or a very restrictive diet, you may not be getting the vitamins you need. The other time that it may be helpful is in macular degeneration, and that's what we're going to be discussing today. Now, you may have noticed that many of the vitamins on the market are named AREDS vitamins, and you've probably wondered where that comes from. Well, that stands for Age-Related Eye Disease Study. This was a study done by the National Eye Institute that looked at the progression of macular degeneration and cataracts and the effect of high doses of some vitamins and minerals. Reviewing the anatomy, we can see where the retina and, more importantly, the macula are looking at the eye. Now, macular degeneration is breakdown of that macula or breakdown of that portion of the retina. Manipulating the eye here, we'll get a better look at the lens of the eye, which is where cataract occurs. So with the cataract, you have clouding of the lens, and that occurs with age, and we're going to see that lens here highlighted in green. And that cloudiness can cause blurred vision, halos, and difficulty driving at night. So what vitamins and minerals did the AREDS study look at? Well, AREDS vitamins included 500 milligrams of vitamin C, 400 international units of vitamin E, 15 milligrams of beta-carotene or vitamin A, 80 milligrams of zinc, and 2 milligrams of copper. It's important to know this because your multivitamin may already include a lot of these. So if you're taking an AREDS vitamin plus your multivitamin, you may be getting too much of one of these. So you really want to check what your multivitamin includes before starting a vitamin. The AREDS study looked at thousands of patients on this high-dose vitamin regimen and found no effect on cataract progression in those patients. It did, however, find that the high-dose regimen helped prevent progression to wet macular degeneration from intermediate or advanced dry macular degeneration only. And so it's important to talk to your ophthalmologist before starting one of these vitamins, as it may not be indicated for you. A majority of vitamins on the market now are actually AREDS 2 vitamins. And so what this was a second study done by the National Eye Institute in 2006, where they again looked at thousands of patients, and they took the original formula and they added omega-3 fatty acids, lutein, zeaxanthin, removed beta-carotene, and decreased zinc. This study found no benefit from adding the omega-3 fatty acids, the lutein, or the zeaxanthin, but there was also no difference when removing beta-carotene. The reason that this was important was that beta-carotene in high doses has been linked to lung cancer in smokers. So if you're a smoker who needs to be on an AREDS vitamin, you want to be certain you're taking the AREDS 2 version and not the AREDS version. So that brings us back to our initial question. Do you need to be taking an eye vitamin? Well, the answer is if you have a diagnosed vitamin deficiency, if you're on a restrictive diet where you're not getting enough vitamins, or if you have intermediate or advanced dry macular degeneration, then yes, you should most likely be on an eye vitamin. Of course, we can never give you that answer without first seeing your doctor. They'll need to examine you and do other tests to make sure that you do indeed need those vitamins. If you don't fall into one of those categories and you don't need the vitamins, there's still things you can do to help reduce your chances of cataracts and macular degeneration. Particularly, you don't want to smoke. You shouldn't be smoking anyways. You want to wear sunglasses to help decrease UV, and you want to eat a healthy diet, particularly rich in green leafy vegetables. I hope I was able to shed some light on the eye vitamin question. As always, you should consult with your ophthalmologist and primary care doctor. If you have any questions, you're always free to call us or visit us at austineyecenter.com.